Welcome to Public Health Matters, where we talk about matters in public health. My name is Jane Goodman, and I'm a public health strategist with the NASHUA Division of Public Health and Community Services. To start our show today, I'd like to do a brief COVID update. Globally, we have 105 million cases with 2.3 million deaths worldwide. In the U.S., we have 27.4 million cases, and our deaths are now at 476,000. Our sympathies go out to all those who have suffered a loss among their family and friends. Looking at the state trends, you can see on the left of this graph that we are trending down. We are going in the right direction in New Hampshire. We have a 4.3% positive test rate for the state right now. That is down a few tenths of a percent from last week. So we are definitely going in the right direction. If we look at the equation on the right of this graphic, we have a 7-day average of 7.4% test positive rate. So that number's in yellow because we're still a little bit cautious. We're not quite below the 5% for NASHUA. We have 26 positive cases on average a day and 355 tests. So that gives us our rate. That includes the antigen and the PCR tests. So our 7-day average, again, gives us a 7.4% positive test rate. Also, a big improvement over the last several weeks. We're hoping it keeps going down each week. And that happens with your cooperation, mask wearing, hand washing, social distancing, and remaining vigilant until we can roll out vaccines to the majority of our population. Looking at the city of Nashua specifically, our total cases to date are 6,085. Active cases in the city right now are 242, and our new infections per 100,000 are 390.5. Again, this number has declined considerably since last week. Our new hospitalizations per 100,000 are 1.1. If we look at the greater Nashua public health region, the cases to date are 13,047, and our active cases are 541. Just to look at this a little bit differently, we have a case counts per week graph, and you can see on the far right-hand side that we are declining dramatically from from mid-January until now. Last week we started the decline that was more dramatic, and we're still trending downwards. So that's great news for our city. That's great news for our state. And we just do ask that people remain vigilant when it comes to COVID-19. We're not out of the woods yet. We continue to encourage people to get COVID tested if need be. When should you get a COVID test? If you develop symptoms such as loss of taste or smell, cough, shortness of breath, fever, congestion, or runny nose, nausea, vomiting, fatigue, or muscle aches. And if you have been exposed to a case of COVID-19, then you should also think about getting a test 5 to 7 days after exposure. So what is exposure? We go over this again and again. We don't want to let up on the testing for COVID. So it's a close contact defined as being within 6 feet of another person for 10 minutes or more cumulatively, regardless of mask wearing. So if you are exposed to COVID-19, we ask that you stay home and avoid contact with people outside of your household for 10 days. Watch for symptoms and get tested 5 to 7 days after you had that close contact. Please do not get tested at the ER. And I can report that test results are coming back much sooner right now. We've fortunately, I guess with the decline in cases and spread, our test results are coming back much quicker. So that's really good news also, so that if you are infected, you can take the proper precautions. And then we do ask if you are exposed, of course, observe that 10-day quarantine. We do have COVID testing on Tuesdays from 3 to 5. It is a free service put through the Division of Public Health. It's at the National Guard Armory. It is a drive-through clinic. It is planned for every Tuesday, weather permitting. You can sign up for that test by calling our hotline, 589-3456, or you can go online to the Division of Public Health and Community Services and sign up there. There's a big button. And now it's my pleasure to introduce our guest for today, Janna Thompson. Welcome, Janna.
Thank you for having me.
Janna's joining us from Harbor Care, from the Wellness Center.
Yes.
And a nurse practitioner.
Yes.
At Harbor Care, which is right in downtown Nashua. And in fact, when we moved our clinic to our clinic at the Elm Street parking garage, we sent everyone your way.
Yes, ours is
you're
Monday.
Very centrally located, and especially for families that are on foot.
Yes.
You know, and that's one thing that we so appreciate, that you guys were able to pick up that role in Central Nashua, because our clinic was getting overloaded and we were blocking Main Street, and we really...
It was good to work together and
absolutely
get everybody served.
So you're part of Harbor Care, which is like an umbrella organization for a lot of different agencies.
It is.
Let's just back up and can you just tell me a little bit about Harbor Care and the agencies that are beneath that?
Of course. So Harbor Care used to be the Partnership for Successful Living, and under what we call the partnership umbrella is Harbor Care Health and Wellness Center, the clinic, the HIV/AIDS Task Force. We have Keystone Hall. We have Harbor Homes, the actual housing piece of it. We have the Veterans Program, and I think I'm covering most of it.
I think you have them all. I have a list here.
So, I think I got them all.
I think you did a good job. Excellent. And so the Harbor Care, the Wellness Center, which is where you work,
yes,
is a federally qualified health center, from what
is.
I understand. And when I think of Harbor Care, I always think, you know, because I've lived in Nashua, in this area a long time, and I think of veterans and homeless veterans, and that was the mission initially of Harbor Care, and obviously it has expanded into all these amazing services and very important, vital services, but they're not just for veterans anymore.
No,
is that correct?
they're not.
So tell me about the health center and who can go.
So anybody can go to the health center. Whether insurance, no insurance. There's a sliding scale, so there's no concerns really about the ability to pay. We started pediatrics. That's what I do, is pediatrics. 5.5 years ago.
Okay.
So that has expanded quite a bit. And we have people from all over the area and some from outside the area that come in for dental, behavioral health, medical services, medicated assisted treatment. And they come from within the umbrella area. They get sent to us, or just kind of come across it.
Or they just walk and they see
it's
a health
not
clinic.
limited at all to veterans anymore.
So it really functions like the FQHC that's across the street, like Lamprey Health.
Correct, yes.
So what about if I come and I don't speak English? Are there translation services?
There are. So we use a translation line, unless we have someone there that's qualified to be a medical translator.
So do you have some bilingual workers? Or?
We do. We have some Spanish, primarily Spanish speaking.
That's awesome. And I noticed, you have a lot of different services. So it's really full service.
Yes.
And the dental operatories, I mean, that's really an incredible thing to have at a health center. They must be busy. Have they been able to pick back up?
They are. It had gotten put on hold for a little bit, and they've recently reopened, which has been a relief for all of our clients, patients, because of the location, and they're familiar and they're comfortable there. And so they see kids and adults.
Wow, that's amazing. And I wanted to know a little bit more about your role. Well, let's talk a little. We like to frame this because we are still in a pandemic.
Yes.
Pre-COVID, post-COVID. So are you seeing patients in person? How have you dealt with the pandemic at Harbor Care to keep patients safe, to keep yourselves safe?
Yes. So it's definitely been a learning curve, I think, for us and everybody this is not something any of us have gone through before. We are seeing patients on site. We have separated our clinical staff. So we have a couple teams, and one team is on site at a time, which allows for the social distancing.
Okay.
They see primarily patients on site, and then the other team does telehealth during those days, which has allowed really to keep all of our patients served and keeping everybody safe.
And do your patients have access to the computer? I mean, has that been a challenge?
It has been a challenge at times for some of the patients. Excuse me. Worst case scenario, if it has to be done with just phone, then that's an option for most types of visits. We also offer what we call a phone booth, where we have a exam room or two designated for those that don't have the connectivity to do a telehealth
so they just
from
use
home.
your computer and
They
talk
can
with
come
the
into the
provider.
exam room, and the provider will video into them.
That's a great idea.
Yes, so that's worked out really well for a good handful of people.
Yeah, and you really have to be creative because one size does definitely not fit all when it comes to talking to some of these vulnerable populations. And there's definitely a technology divide. We're seeing it in the schools. We're seeing it, accessing care and accessing services.
It's been difficult for many of them.
But you were able to at least reach many through telehealth and then the rest in person.
Yes. We had a week or so where we did all telehealth just because of the safety in the building at the time. But other than that, we've remained open for the whole pandemic.
Wow, that's great.
Yeah.
And important because people they can't ignore their other healthcare issues.
And we certainly don't want them at the ER.
Right. And that's a big point. We always say, please do not go to the ER, especially when we're talking around COVID now too. That's not a good use of healthcare resources, and it's not very efficient. And, the people that really need the help at the ER they're going to be delayed because you're presenting. And with COVID, it's a safety issue too.
It really is.
We don't want people that are potentially infected.
And with little ones, pediatric little ones, I've always really kind of been pretty stern on the ER is the ER. That's not where we belong for, sore throats and this and that. We need that because the safety piece now, but even prior to COVID, the safety piece for our youngest vulnerable little ones going into the ER where there's all kinds of germs that they're not exposed to normally. And then they go in there sick and come out sometimes even sicker, unfortunately.
Right. Yeah, you don't want to be in the petri dish, so to speak. Not that our ERs are not clean, but if sick people are going there, then there is a risk. So one thing I noticed, Janna, is that on your signature, when you sent me the email, is that you're a certified mental health
I am, for
counselor
pediatrics.
For pediatrics. So this is a big deal. And so that was like a bonus for me because we talk a lot about mental health issues in public health right now.
Absolutely.
So we've done this thing to make everyone safer and kept our kids home and done remote learning, and they're isolated. And so you must be seeing a little bit more in your practice.
And I am. And the ones that were, some of the kiddos that were stable for so long and doing well on the, current medications or whatnot, are really, they're really struggling. And it's a balance of, is it, so to speak, a medication or therapy issue, or is it just the pandemic?
Yeah, the isolation.
It really is, and we have to think about a lot of these kids. Some of them are living in shelters, so they don't have, the nice school desk to set up at for remote learning. A lot of them don't have Wi-Fi. They don't necessarily have someone home with them during their remote learning because their parents need to be at work. They don't have jobs that they can do remotely. So these kids are on their own. Some of them don't have safe neighborhoods to go outside and kind of expend that energy.
Right.
So it really, it's been a struggle.
Yeah.
And I think, it's been a struggle for adults, but these kids are just, they don't know what to do with it.
Yeah. So what are some tips we can give to parents for their kids that are struggling? Because I could use them myself. I mean, I have kids in high school now, but at the same time, the isolation,
Yes.
even if they're seeing some of their friends outside and their friends might come over and shoot hoops in the driveway, it's still very difficult. And even if they're going to school, some of them, they're starting remote learning next week.
Yep.
They're still wearing masks. It's a very different world with the hybrid version of learning.
It is.
And because teachers have to be prepared in both areas, they have to be able to teach to the kids that are not coming into the school and teach to the kids that are in the classroom.
And this is new to the teachers.
Right.
So they're trying to, this isn't something, just like healthcare wasn't really trained to be in a global pandemic. These teachers certainly weren't.
Right.
And they're used to being able to connect with their kids face to face. And now, again, yes, we're doing it either through a screen or through a mask, which can be really difficult for everybody involved. And I think, I always tell parents a routine is important. Let them feel like they're at school as much as possible. If they pack a lunchbox at school, then they pack a lunchbox at home.
Oh, that's a great idea.
They have their set snack times, because we all know that kids will graze all day and they'll walk
As will
away.
adults when they work from home.
Exactly. I think we all have.
Not that I have any experience with that.
I'm hungry, I'm going to walk away from the computer and go get a snack. Or, I'm going to go have lunch, even though lunch is in a half hour. It's important to even, keep the lunchbox aside, and whatever their set snack time at school is, that's their snack time at home. Whatever their lunch is, that's their lunchtime at home. It's important to keep that routine. Their desk pencil box, if they have one at school, really kind of set that bar that this is at school, it's just from in a different location.
So I'm curious to know also, what are some of the signs that parents can look for? Because, at this point, I kind of feel like everyone's blue. But when do we really have to know that it's time to get more help for your child than, I tell my son, stick it out, stick it out. I mean, how many times am I going to say that? It is what it is.
It's not that we can do.
But when do I know? When can a parent or a friend or a neighbor, like you said, some of these parents aren't even home during the day because they have to work, and that's totally understandable. But what are some things that we can look for in kids that, this is not just the blues anymore.
This is not just the pandemic blues, so to speak. So some of it is age dependent. There's certain age groups, a lot of our adolescents, if it's a child that doesn't typically talk about their feelings to you, and all of a sudden they're saying, I don't feel quite right, I'm struggling, I'm not doing okay. If their grades, which we know that grades have been kind of a little bit different now because of remote, but if their grades are extreme one way or the other, that's not characteristic for them, then you need to look into it a little bit more. If they start to just hide away, they're in their room, they don't come out unless they're made to, they don't even want to socialize with their friends on their phone or on their computer or face-to-face, or, hygiene. Any big changes should really kind of bring up a red flag. Sleeping way too much or being up all night.
Okay.
So a lot of it's the extreme.
The extreme things to look for. So we're going to look for the extreme things. We're going to keep our kids in a routine. Anything else?
Get them outside if you can.
Yeah.
And if you can't go outside because it's so cold, or it's not a safe area, find something inside that gets them up and moving. These kids aren't moving; they're sitting in front of that screen, and we have emphasized for I don't even know how many years, minimize screen time,
Right.
no more than 2 hours a day. Well, now we're telling them to sit in front of that screen for 2, 3, 4, 5, 6 hours a day.
Right.
They need to get up from there. They need to get up and move, whether it be outside for 10 minutes walking around, or find something, depending if they're younger, jumping around in the house, dancing, something to get them moving, get them away from that screen.
Yeah, you almost need that structured gym time.
Exactly.
Put into the day, like, okay, now you're going to go run around your house, or
these
I wish
younger kids
do like
are
a
used to having
scavenger
gym
hunt.
and recess.
Yeah, they should, that's such a, listen to me, like, that's a good idea. Have a scavenger hunt
Yeah.
during like one of your breaks and then come back and,
Kids love to dance.
Dancing.
Put some music on.
Yeah.
Get them up and moving. That really, not only does it break the monotony of the screen, and not only does it, is it healthy, but it brings their mood up. If they're up dancing and laughing and having fun, it automatically brings up their mood.
Yeah.
Even if it's just a little bit.
Well, every little bit counts at this point.
It does right now.
Yeah. So I believe it was you that's working on the immunizations. You do a lot of coordination for vaccine.
Yeah, I'm one of our vaccine managers in general for the clinic.
Okay. So I want to talk to you a little bit about vaccine hesitancy before I bring in the big, elephant in the room about the COVID vaccine. Yes. But there's been vaccine hesitancy for years, and it's not just around the COVID vaccine.
Correct.
So let's back up and tell me a little bit about your experience with that and dealing with that.
Sometimes I see it a little bit more here than in previous areas that I've worked with. Just some of it's a lot of lack of knowledge. Some of it's just that not trusting or not going off social media. Let's face it. A lot of people will look at social media, and if it's on Facebook or whatnot, it's got to be true.
Yeah, it must be true.
So it's kind of just sitting down and having a discussion. Like, this is what you're reading, but this is what is really happening. This is what you're preventing in your little one with these shots. May they get a fever? Possibly. They might feel a little icky for a day or two, but the end result is you're protecting them from so many illnesses that
are much worse if you
that
get
are
them.
much, much worse. I'm very open to having a little bit of a delayed or alternate schedule. I have no problems with that whatsoever with parents. I'm very open about that with them. If they're really hesitant, we kind of take the approach of, well, why don't we do these two now? And then next month you can come back in and we'll do two more. So we're not, their concern is oftentimes the amount that they're getting at once.
Okay.
So we spread them out.
So now we have this COVID vaccine.
Yeah.
And we have some hesitancy among some of the populations that Harbor Care, quite frankly, serves. And so we want to just tell me, why should I get the vaccine? I mean, I am fortunate. I work for public health.
Yes.
We do a lot of clinics, so we have been vaccinated.
Yes, they were with us at one last week.
Yes. So your staff has been vaccinated at Harbor Care. Any of your clients yet? Or?
Not yet. Well, I shouldn't say that. We do have a few adult clients that we've gotten stuff from that have gotten vaccinated. Dealing with the pediatric population, I work on mostly getting the parents vaccinated of kids that are at risk.
Okay. If you're a caretaker for someone that's under 16, you are eligible for that vaccine.
Correct.
So that's a really important message to get out to our audience as well. Because that means, so have you been contacting those parents then?
I have.
Yeah.
So some have reached out to me and said, hey, I don't know what to do. And others I've said, Johnny has A, B, and C. Johnny can't get the vaccine, but you can.
Right.
And it's the same process for adults under 65. The paperwork has to be filled out justifying why.
Right. They have to have two conditions, two comorbid conditions.
That's the guideline. Some of the times it's got a little bit of leeway depending on the type of diagnoses. If it's a little one that really may only have one that's listed, but has some other stuff that really would put them at risk, then you can put the parent in to get the vaccine.
Yeah, so it's a little bit, there's provider judgment involved.
There is, yes.
Which makes sense. I mean, we just by looking at a computer printout or a spreadsheet or a medical record, nothing's on paper anymore. But you can't necessarily tell. So it really takes you knowing your patients and knowing what their situation was. So you've had some parents come in, hopefully, or you will be getting them in for a vaccine.
I've sent in a stack of forms for parents of kiddos after I get their permission. Obviously, I don't do it until I talk to them and know. Some of them have felt a little comfort in the fact that I've gotten it. I'm not against it. I promote it. I think it's beneficial. None of them want to see their little one get sick because they didn't get a vaccine.
Sure.
And it's kind of debunking some of the social media myths
Right.
that you're seeing.
Yeah, and you're an experienced provider, and so we don't want people to be afraid of this vaccine. And one thing we promote a lot is that this vaccine, the viruses that are like this COVID-19, the SARS-CoV-2 virus, have been studied prior to this for years.
Yes.
And because the science was understood, the vaccine development happened much quicker. And so it wasn't a rush.
No,
it went through all the same stages and all the same trials, and that's what we just want people to understand.
Yeah, and we do have that talk. How do you trust it if they rush through it? I'm like, no, it was a priority. We know that we can't test vaccine efficacy or do any clinical trials unless there's large numbers of the illness. So some of the vaccines that they come out with, you don't see a lot of the illness. A little bit here and there. Well, we've had plenty of people to be able to study it, and the money's been put there. Let's face it, it takes money.
Yeah, but that's a very
research.
good point. This hasn't been like, a freebie that we just kind of put in a shot. So I think that's very important. So I just want to remind people that right now we are in phase 1B of vaccine dissemination, and so that means if you're older than 65 years old, you can sign up. You can do it through 211. You can do it through the website, nhvaccines.gov or vaccinesnh.gov. We'll put it up there to make sure that I'm saying the right thing. We continue to vaccinate all our healthcare workers and our first responders if they're not done yet. We are getting to the residents and staff of residential facilities, long-term care, corrections officers, and I do want to go back to, kind of your area as the medically vulnerable. So if you are a caretaker for someone that's, less than 16 years old and they have those chronic conditions, we want to keep you healthy because your child can't afford to get that.
Correct.
The COVID virus. We just don't know how they're going to react to it. So we just encourage people that we do have the vaccine. It's good news. The vaccines are here. They're safe and effective. Both you and I can testify.
Yes.
We survived them. We are feeling great. They're free. There's no need to pay. Right now, you need 2 doses of the vaccines that are available on the market. More research is coming out, hopefully soon, that there'll be a 1-dose shot available, but we're not there yet.
Right.
So protect your family. That's the biggest reason. Protect our community.
And if you have a difficulty navigating the system or getting where you need to be for the vaccine, reach out.
Yeah.
Reach out for that help.
Yeah, and I did want to just put a plug in for Harbor Care and Wellness Center that you guys are open every day of the week. You have 2 locations. You have one right in downtown Nashua.
Correct.
And then one just up Amherst Street a little bit.
Yes.
All right, so and that number is 821-7788.
It is.
And, obviously don't just show up, call for an appointment. You do the COVID testing Monday afternoons.
Yes,
and you're really hard at work, Janna. Thank you so much for all the
Thank
work
you for
you're doing
having
for
me.
our community and for helping those parents navigate these really difficult waters with their kids. But they're lucky. They're lucky to have providers like you and your organization.
It's a great organization.
Yeah. So, and I want to thank you for joining us. We'll be back again next week. We do have a COVID testing clinic every Tuesday from 3 to 5 at the National Guard Armory. Check the weather just in case. We do it outside. It is a drive-through clinic. You can sign up through our hotline, 589-3456, or you can go online to the division website and press the big button and fill out the form. Until then, have a safe weekend.